Well, thank you, everyone, and thank you, Larry. My goodness, it is an absolute pleasure to be here, as it always is with the Chamber. Just by way of introduction, thank you for the honor of serving as chairman of the Health Industry Committee for the Chamber. It is a labor of love and something that we really believe gets to what Rep. Danny Davis was saying. My goodness, people don't need just to have the will and the drive to become entrepreneurs successfully. People need to know how. And over the course of this conversation, uh, Senator Kayla, you never failed to amaze me. I think that the number of subject matter experts that we have assembled here is phenomenal. I'm pleased to be able to work with all of them on a daily basis, and I'm fascinated by every conversation we have. And I appreciate the opportunity to have you directly listen and opine regarding the subjects that we'll be discussing. So thank you for joining this panel. I do just want to take a brief moment and kind of let the audience know what it is we're trying to do. We have a group of really, it's actually not overstatement to say world-renowned experts. Each of the individuals on this panel has done phenomenal things globally. It's just a great group of subject matter experts. And what we're going to do is we're going to allow each of our panelists to present a little bit of their subject matter expertise as it relates to healthcare. And what you'll see is that people will be coming at this conversation from multiple different angles that really will illuminate not only where we are in the state of Illinois, but what the path forward looks like with the SIMPCO solution and other efforts that are underway within the Illinois State Black Chamber of Commerce. I do want to make one comment, and I want you to frame the comments that you're hearing from our other subject matter experts around this simple consideration, because this is a convention for the Chamber of Commerce. It is a simple fact of public health that best outcomes are produced not just by entities that are good, not just by entities that are culturally sensitive, but by entities that are culturally specific. And that in a phrase is the business case for why there needs to be a much greater level of involvement of diverse businesses in the delivery and the business of healthcare in the state of Illinois. So with that being said, allow me to give you some brief comments on the individuals that will be serving on our panel. We actually have two panels. The first panel is going to be our subject matter experts, and subsequently we'll be bringing on other entrepreneurs around the state who will talk about how they hope to participate in some of our upcoming efforts. But allow me to make some brief introductions. Dr. Carol Adams is here. She's the former secretary of the state of Illinois' Department of Human Services, which is its largest agency. She managed this agency with 14,000 employees and a budget of over $6 billion. She is also the past president and CEO of the DuSable Museum of African American History, the oldest and longest running museum of African American history in the United States. Her extensive connections, relationships with communities throughout Illinois, and expertise suit her perfectly in her role as SIMPCO's Chief Community Engagement Officer. Welcome, Carol. We have Marlo Kemp with us. Marlo Kemp has served as Deputy Chief Financial Officer for Cook County Government and the Chief Financial Officer for the John H. Stroger Jr. Hospital of Cook County. He has also served as the Chief Financial Officer for the Forest Preserve District of Cook County, the Village of Hazel Crest, and the Roseland Community Hospital. At Cook County, the former Cook County, he oversaw the budget review process for the county's $3 billion annual budget and reconciled budget requests to funding estimates. His vast experience guides SIMPCO currently, domestically and internationally, as our Chief Financial Officer. Welcome, Marlo.
Thank you.
Arnold Crater has served as Chief Information Officer for Illinois' Regional Transportation Authority and Director of Worldwide Technical Support for Motorola. In this capacity, Mr. Crater actually provided IT operations and integration oversight and governance for the 6 county regions served by the RTA system of public transportation, including the CTA, Chicago Transportation Authority, Metra, and Pace Bus. He is SIMPCO's Chief Information and Technology Officer. And we also have Dr. Neba Lubin-Johnson, who is a legendary advocate of quality healthcare for all, especially the underserved and underrepresented. Dr. Lubin-Johnson was in private practice for 28 years in the Southside Chatham neighborhood where she grew up and currently resides. She has served as an attending physician at Mercy Hospital and Medical Center, associate attending at Advocate Trinity Hospital, and a clinical instructor at the University of Illinois. She famously served as the 119th president of the National Medical Association, America's oldest and largest association of African-American physicians dating back to 1895. And she currently serves as the Chief Health Officer for SIMPCO. And that is our initial panel. Welcome to you all.
Thank you.
I actually would like to begin. Let me just make sure that we have everyone here assembled. I don't see Dr. Adams. Is she with us? I don't see her. So what I'd actually like to do is I'd actually like to set the table by beginning with some of the financial considerations, because this really is an economic conversation. And as we talk about things over the course of this conversation, we're going to weave in and out of considerations of public health, medical considerations, and most especially the economic impacts, which both are social determinants and influences of health and represent the solutions for some of the best practices and outcomes that we'd like to produce. So I'm going to set the stage by actually beginning with Marlo Kemp, our Chief Financial Officer. So can you just kind of give an overview of how you approach the financial considerations in the state and where opportunities exist, and where the path forward may be in your estimation? And also, I'm going to ask each of you to speak to some trends that you have been on top of nationally and how they reflect on what's happening in the state of Illinois. Marlo, and do all of that in 2 minutes. I'm just kidding.